My name's Elizabeth Ganford, and this is
Doug Ganford.
And can you tell me your age and your height?
I'm 62. My height is 5'10".
And how much do you weigh?
220.
Okay, sounds good. So today we're going to be doing a neuro assessment. First, I would start with a general assessment after I wash my hands first. We're going to take a look at his clothes. He's got his socks on. He's got jeans and a t-shirt, which is very appropriate. He's not wearing shorts because it's the middle of winter right now. He is able to tell me his level of consciousness. He knows where he is, the date and the time. So there's our general assessment. We're going to skip the HENT exam and go right into testing the trigeminal nerve. To test the trigeminal nerve, I have a little cotton swab. I'm going to put it over the top of his arm. Generally, this is a sharp, kind of a sharp feeling. And we'll go on top of his forehead. You tell me what you feel.
Soft.
Okay, and then your cheek.
Soft.
In here.
Soft.
Okay, this is testing. There's 3 branches of the trigeminal nerve, and all three areas are intact. Next, we'll go to the facial nerve, which is cranial nerve number 7. I'll have you close your eyes. Close your eyes really tight, and don't let me open your eyelids. Okay, and you lift up your eyelids. All right, and then smile and show your teeth. Okay, then I'm going to have you puff out your cheeks, and when I push on them, don't let me push the air out. Okay, very good. Facial nerves are intact. Next, we'll do the cranial nerves 3, 4, and 6. I'm going to have you follow my finger. And you want to do this really slow because you're checking for any nystagmus. Okay, looks good. And we're going to test for the corneal reflex. I have another cotton ball. I'm just going to put this on the side towards his cornea. Okay, and then this would make the patient blink. If they're blinking, you don't want to try and stick it in there. You know that the corneal reflex is intact. Then we're going to look at the pupils. I'll grab a flashlight here. Normally you would turn all the lights off and have just the door open to your room, but we're in an open area, so we're not going to be able to do that. But I'm going to have you open your eyes, look straight ahead. Okay. Looks good. The pupils are round and reactive to light. His pupil size is about 3 millimeters. We're going to test to make sure that the opposite eye constricts. I want to flash a light here in the left eye, and his right eye accommodates and restricts. Same for the other side. And for accommodation, we'll have you look at the picture on the wall back there, and then keep looking at the picture, and then now look at my finger. Okay, and his pupils constricted and they converge together. If all these tests that I've just performed have been positive, you can say that his eyes are perla, which are pupils are round, equal, reactive to light, and accommodation. Well, that's good for the eye assessment. Next, we're going to go to the optic nerve, which is the cranial nerve number 2. And to do this, you would test with an Snellen eye chart. I don't have one right now, but I'll go through and explain it. With the Snellen eye chart, it's a letter chart. There's 11 lines with block letters. On the top one, there's usually a big E, and the next line, the letters get smaller each time. The top letter would be 2020, and then it goes on and so forth. You would cover one eye and read the letters until you can't read them anymore, and then you would do the same for your other eye. The first line was 2020, the next would be 2100, then 2070, and so on. Another test you can also do is covering each eye and checking all eye fields towards every corner. So we're going to close this, and then you tell me when you can see my hand coming in.
Okay.
Okay, and then up here.
Alright.
Okay. It's kind of hard to do this. I'm going to come to the other side and come up from the bottom.
Yeah.
Okay.
Yeah.
Okay. Okay, that all looks good. Then next we will go to testing the acoustic nerve, which is a gross hearing test. I'm going to have you put your finger over your left ear, just slightly over your left ear, and then I'm going to whisper something into your right ear.
Yeah.
Okay. So the whisper test works. He was able to hear correctly. That's cranial nerve number 8 that we just went over with the acoustic nerve. Next is the cranial nerves number 9 and 10, the hypoglossal and the vagus nerve. If your patient's speaking well and swallowing okay, you don't need to test the gag reflex, but if your patient is unresponsive, then you would use a tongue depressor on their tongue to test their gag reflex. Use my flashlight again. I'm going to look at your uvula, so I'll have you tip your head back a little bit and open wide and go ah. Okay, that's testing the uvula, making sure it's symmetrical and it's the rise and fall. And his does that as it should. Next, the hypoglossal nerve number 12. You have you stick your tongue out and then move it from side to side. Okay, he's able to do that okay. And then towards the end of our assessment here, we'll do the completion of the neuro assessment. I'll have you do a bunch of things with me, okay? So I'm going to have you hold out your hands, and you're going to put your fingers in from your pinky on into your thumb. So just roll your fingers in and then roll them out. And we'll do that again. Okay, that works pretty good. And I'm going to have you stand up, and you're going to put your heel on your opposite shin and just go up and down your leg. Okay, and the other side too. Okay, alright, now you can sit. Okay, I'm going to have you put your finger on your nose and then touch mine. Okay, we'll do it again. And come over here. And one more time. Okay, this test is looking for any cerebellar problems. Okay, now we're going to do some walking. So I'll have you stand up and just walk a little bit that way and then come back. Okay. And when you go back, I'll have you walk from your heel to your toe. Okay, then you can go ahead and come back. Okay, really good. Okay, so I'll have you keep standing for me. The last thing we're going to do is do the Romberg test. Okay, so you're standing vertical. I'll have you open your eyes and close them. Now close them. Keep them really closed. Put your arms to your side. This is testing for any swaying, and when you do this with your patient, you want to make sure you have them braced somehow with the back or in the front or the side. And he's swaying just a little bit to the side, but he's doing very well with it. Okay, so then I'll have you sit down. His balance seems accurate here. So at the end of my assessment, I would wash my hands again. And do you have any questions?
No.
Okay. Well, that's the end of our neurological assessment.